Sorry, sit down. There we go. Man, it's hurting cats, isn't it? Okay. What we're going to do in this session, in terms of the question and answer, which is important to note now, we're going to have, after each one of our panelists gives you some information, we're going to have an opportunity to ask one clarification question. We're not getting into the substance yet. And then all other questions in the Q&A period will be done on cards once again. So there's cards in your table. We're trying to encourage you to do 140 characters. And if you could write down who the question is for, that would be extremely helpful. We'll introduce the panelists. Otherwise, I want to turn it over to my colleague, Francois, the debonair livestock advisor for the G Global Practice. And we have a great set of panelists, so if we can get your full attention, Francois, over to you.
Stephen, thank you very much, and thank you all. Let me tell you, first of all, that we are very excited to have this session. Livestock matters. Yes, it does, because this is a wonderful tool to get out of poverty. It's not to an assembly like yours that I will advocate for livestock and the benefit it can bring to the 17 SDGs. But in the same token, the increased production of livestock brings with it, negative impact. And this is a sector that indeed needs to be checked, and for which we need an oversight. Today we have picked two what we call emerging issues. It's funny, when I was discussing with the panelists, they said this is not emerging issues. This has been with us for a while. But these are the type of things that we need to be aware of. And so we are delighted to have those panelists with us who are going to raise this awareness in the room. And I hope you will enjoy. I'm sure you will learn a lot today. So the two issues that we have picked for you is AMR. Let me check. Ethel asked me to check on the room. Who knows what AMRs means? Can you raise your hand? Okay, it's a 2% the room, Ethel, so you were right. Okay, so you will learn about it. Antimicrobial resistance will be the first subject we will discuss, and then we will move to a second one on animal welfare. This session, I think, comes in a strategic time, because as you know, livestock is growing. Our client countries are demanding more and more our support for livestock activities. As we speak, there are several standalone livestock projects that are just starting to be implementing or are in a design stage, and is going to grow and expand. So we have a skyrocketing portfolio on livestock, and those issues that are linked to this negative impact will also, of course, going to come back to you, and you will be asked. So that's why we want to bring that to your attention today. So let me quickly introduce our panelists. You have the bio on this forum document, so I don't want to be too long on this one. But I want just you to see how diverse the panel is, and you will understand in a minute why. First of all, let me welcome Janice Cox. Janice is the co-founder and the director of the World Animal Net, an international animal protection organization, which was founded 20 years ago, to build expertise, information, and best practice resources to support the development of animal welfare. So here we can say we have NGO, civil society representation through Janice. Thank you, Janice, to be with us. Next to you is Jean Moses, who is the senior strategist for the global agribusiness team in IFC. And Jean is responsible for developing and communicating the department's strategy, thematic issues, and development impact in the sector, managing key partnership and coordination with the Agriculture Global Practice and other part of the World Bank. And Jean is going to give the perspective of IFC on animal welfare. Then we have Daniela Battaglia, who is from FAO. She's the livestock development officer in the FAO, and she's both working in the working group for antimicrobial resistance, AMR, and also the focal point, I think, for that, but also involved in animal welfare. So she's in the center of the panel because she will both talk about animal welfare and AMR. Next to her, we have Donald Schreiber, who is from the Centers for Disease Control, CDC's Atlanta, seconded by CDC's to the Health Global Practice Team Events Shop and the World Bank. And as you can imagine, Donald is going to tell us about AMR, right? Not now, a minute ago. And then the last panelist is Catherine, who is from the French embassy here in Washington, D.C. She's a vet. She's inspector in chief on the public veterinary health, like myself. And she's the deputy counselor for agriculture in the embassy. She has been there for 5 years. But in previous job, she has been involved in agricultural issues in France. And you will see when you read the bio, which is not in the, unfortunately, we will send you the bio later, that she's highly qualified to speak about AMR. So let's start with AMR, right? I'm reading my note here. The increasing emergence of antimicrobial resistance creates a global public health threat. It impacts humans, it impacts animals, and the global economy. In addition to the 700,000 human deaths annually attributable to drug resistance pathogen, the livestock industry faces a situation where growing levels of drug resistance could mean a 7 to 8% decrease in livestock production by 2050. So AMR is a global challenge that needs to be addressed at the nexus of human, animal, and environmental health. Don, I will ask you to come here and to introduce the subject and give us the global perspective. Why is it a global threat? Tell us about AMR. You have 7 minutes.
Thanks so much. It's a privilege to be here. It's been a revelation to me over the course of my career in human health how essential it is that the agriculture sector work with the health sector. When we do, we get great things done. When we don't, the consequences are horrific. Almost 20 years ago to the day, I stood with the head of infectious diseases at CDC in Atlanta inside our highest containment lab where we study Ebola and Marburg and other diseases that are some of the most lethal agents on Earth. And I said to him, "This must terrify you." And he said, "No, what terrifies me and what keeps me up at night is antimicrobial resistance." Let's take a walk over to that lab. It doesn't look nearly as scary, but it is. Antimicrobial resistance is the story of the struggle between bugs and drugs. All around us in the environment, on our bodies, in and outside the bodies of animals, are all kinds of bugs or microbes, parasites, funguses, bacteria, protozoa, and for the most part, they're very innocent. Sometimes they're even helpful, as we're learning, but in many cases, they cause disease. Sometimes mild disease, moderate disease, but often they're responsible for scourges that affect whole populations, particularly in lower income countries. Beginning in the last century, we began to come up with miracle treatments that made people better. They saved literally hundreds of millions of lives. So many kids are alive today who wouldn't have been alive in the last century because of these drugs, whether it was penicillin or drugs to treat tuberculosis or antimicrobial, antiretroviral drugs to treat HIV. People are alive today because of these drugs. But the wonder of these drugs also meant that they were used indiscriminately. There's been misuse and overuse in both the human and animal sectors. There's been an irresistibility about using them. And every encounter between a bug and a drug is an opportunity for that bug to try to outsmart the drug, to evolve and to resist. And when that resistance occurs, the drugs are rendered less effective or ineffective. Now, it needs to be said that the only problem in the world is not overuse, but in many of the countries in which you work particularly, people and animals lack access to antimicrobials. And we can't simply tell part of the story. You can't tell a farmer who wants to make his livestock grow, oh, don't use that. You can't tell a parent who wants to make a child in a village, don't use that drug. That's overuse. So we need to look both at access and excess. But the story of what happens when drugs are overused is quite devastating. Diseases become more difficult to treat. People get sick, they die. In many, as we've said, antimicrobial resistant illnesses can result in hundreds of thousands of deaths. And what we really fear is something that will spread out of hospital settings into the broader community and will take off and begin to act as an epidemic like we've never seen before. At CDC, we've documented in the United States tens of thousands of cases of antimicrobial resistance that result in severe disability and death. And we have pretty good surveillance systems. In most of the world, we don't. One of the scary things about antimicrobial resistance is how easily it spreads. 20 years ago, when I went into that lab in CDC to learn about the spread of antimicrobial infections, what I was told was they spread in hospitals. But as time has evolved, we've come to see, no, they spread globally from people to people, from animal to animal, and they even cross species. So with greater travel, with greater trade in the livestock sector, we see the movement of antimicrobial agents in ways that are really frightening. We at the World Bank did a study to look at the impact of antimicrobial resistance on human health, on animal health, and importantly on economic health. And what we found was deeply disturbing. The development economists created a model, and it was a model. It was a model looking at macroeconomic impacts from antimicrobial resistance. And they had a high bad case scenario and a low better case scenario. And even in the low case scenario, they found that $1 to $2 trillion in economic output could be reduced by 2030 and $2 billion by 2050. Looking at the high scenario, what they found was that there could be a reduction in economic output equivalent to the recession in 2008, 2009, reductions in growth of around 3.8%. Most important, and those reductions, unlike the Great Recession of 2008, 2009, would be felt less in high-income countries and more in low-income countries. The impacts they found on extreme poverty and on the ability of the livestock sector to earn incomes, to be productive, and to protect their valuable assets were really quite devastating. So I hope we can talk today about some of these impacts and about what can be done at the country level. Because if I would want to leave you with one message, it's that while there are many interventions, there's no recipe, and everything needs to be content or context specific. So thanks, and I look forward to the discussion.
Thank you, Don. Yes, please, do so.
One clarification question. Remember, any of the substantive questions, write down with his name on it. One clarification question on this at all? All right, we'll save it for the substantive. We'll save it for the substantive. I'm going to get that word correctly in my mouth. Who's next?
Next is Daniela.
Now, can you two gentlemen stand up for a moment? Just stand up for a moment. What is similar between these two gentlemen? Look at that eyewear. Huh? Look at that eyewear. That is some stylish eyewear, isn't it, ladies and gentlemen? Yeah, yeah. Sorry. Oh, back to business. Pardon me.
Okay, so yeah. So now we have Daniela. Daniela is from FAO. So what we'd like to ask you, Daniela, is to tell us what, in your views, are the implications for the sector, for the livestock sector, and bring also not only the FAO experience, but the tripartite, FAO, OIE, WHO. Tell us about the recent political support that you got from UN General Assembly, from the G20, and tell us a little bit about this country action plan, if I may ask. So, okay. You have the floor. 7 minutes.
Thank you, Francois. Good morning to everybody. I will start by trying to answer your question with what you started at the beginning. Is antimicrobial resistance an emerging issue? Well, actually, maybe not really. Already Fleming in the 20s, when discovering penicillin, was warning us that in the future we might have faced with the problem of having bacteria already resistant to antibiotics, one specific type of antimicrobials. So already the warning was there. I think what we have seen in the latest time is that the attention and the concern on the antimicrobial resistance shifted from the academia, the research center, the public health world, to a wider public, and to a more erased up into the political arena. We've seen, as Francois was mentioning, in September of last year, the issue was discussed at the UN General Assembly. It was the second time that an issue of health, related health, was addressed by the United Nations, and the specific resolution was taken highlighting the need to act, then recognizing antimicrobial resistance as a public global threat. G20 summit, again, September of last year, addressed the issue. So more and more, it has been recognized that it's a shared responsibility. It's not only a problem of the medical field anymore. It's not only the doctors that need to take action, but all of us, especially working in the agricultural development, agricultural scenes, need to feel that responsibility and acting as necessary. The private sector has become extremely aware of that. At FAO, we get weekly visits and concern from different players, being big drug producers or the meat industry, the dairy industry, and so on. So the necessity is there. Yes, antimicrobials are heavily used in the agricultural production. I would say not only in livestock, also very much in aquaculture, in plant production, also in the agro-processing industry, for instance, in the biofuel industry, producing the bioproducts that in turn are consumed by the animals. Antibiotics are used. So the use is widespread. We know not enough of how much is used, and also in which species, in which sector, for which reason antimicrobials can be used for therapeutic reasons to treat our animals, but also to prevent the spread of diseases, and also to increase growth of those animals. So we need to know much more. We need to gather those data to see where we need to act. But given the multidisciplinary of the topic, given the is really complex issues that in turns involves different sectors, it calls really for concerted action, like the one, for instance, that we normally call the One Health, so an approach that looks at the human health, at the health of the animals, at the health of the environment, the soil, and so on. And that's why, for instance, the three organizations which are concerned, the World Health Organization, the World Animal Health Organization, better known for its acronym OIE, and FAO, are working together strongly in a coordinated approach through tripartite activities, and they work very much with the countries, as was saying before. Yes, it needs a global approach, it needs a global call, but actions have to be taken at country level. So we are supporting together countries to develop and implement national action plans. National action plans that could be coherent with the global action plan development by WHO 2 years ago, and in turn for what regards the use of antimicrobials in agriculture and food production, what has been developed by FAO, our own action plan, and it really goes around what it really is needed to minimize or to possibly prevent antimicrobial resistance. We need a lot of awareness raising. Many players are still not aware of their own responsibility and are not aware of what to do. We need to share the information and knowledge that we have, because we do know how to address the issue, and how to address the issue especially in the agriculture and livestock sector. So sharing those good practices that have to do with biosecurity externally to the farm, within the farm, especially animal husbandry management. Antimicrobials should never be used to cover the bad management at the farm level, and that's what we should try to avoid. So an animal which is normally well taken care of, which is in good nutritional health, with good housing, well kept, well treated, is an animal that in turn is much more resistant to diseases. The welfare of the animals, and we will talk about that later, is very much important. But also there are many alternatives to the use of antimicrobials. It needs to be possible for those symbiotics, organic acid and so on that could be used, for instance, for growth promotion, to have the legislative framework that allows for its correct use. And also, I would like to mention as a final statement what came up in a report in December of last year from EFSA, the European Food Safety Authority. We should start rethinking about our food systems and our agriculture and livestock production systems, and go for those that have inherent less need to use antimicrobials. So leaving you for that thought, I think it's time that we go to next speaker. Thanks a lot for your attention.
Excellent. Well done. A clarification question? Clarification? Otherwise, if you have your question, write it down with the presenter's name. Over to you.
Thank you, Stephen. So we went from the global to the sector. Now we're going to the country level. And we will ask Catherine to tell us about what we call a success story in France, the Eco-Antibio initiative. Why don't you come and tell us about that? Thank you. 7 minutes.
Good morning, everybody. It's a pleasure for me to be here this morning, and I thank the World Bank for having invited me. So I will present you the Eco-Antibio initiative. So first of all, there are 4 key ideas. First, the fight against IMR is one of the major challenges of the 21st century for France, but it's One Health, so not only animal health, but animal health, human health, and the health of the ecosystems, and it's worldwide. Eco-Antibio, eco as economy of antibiotics, is the response from the French government to that challenge. Eco-Antibio is a success. Yes, we can. Yes, it's possible to reduce the risk of AMR. And the 4th key idea is the French position at the international level is to obtain the phasing out of the misuse of antibiotics. So the misuse is for us the use of antibiotics as growth promoter. Antibiotics are health products, and they are there to cure sick animals. They don't have to be used as zootechnic tools to improve and to increase the production. So in Europe, since 2006, antibiotics have been prohibited as growth promoter. And Eco-Antibio has been launched in November 2011 and implemented from 2012. What are the objectives? We have two objectives. First of all, the quantitative objective is to reduce by 25% in 5 years the use of antibiotics. We are not against the use of antibiotics. Very important. The antibiotics has to be used at the right doses whenever necessary, and what we want is to change the practices. The second objective is the qualitative objective, is to focus on what we call the critically important antibiotics. It's the antibiotics which are needed for the animals. They are needed, there is no replacement, because we know that there is the development of new antibiotics in animal health is very small. So what is this plan, the program? It's a comprehensive program on 5 years, which involves everybody on the chain, from the farmers to the technicians, to the vets, to the public authorities, to the pharmaceutical industries. And we have 5 priorities and 40 measures. The first priority is to promote best practices and to raise awareness of the stakeholders. I will show you some examples. So it's focused on farmers, technicians, and veterinarians. So we try to promote good practices in hygiene, is good and husbandry, in good farming, in animal welfare, in maintenance of the building, and we developed some guidances. And because you know, when animals are in a good health and are happy, they are not sick. So we don't need any antibiotic. We try also to develop initial and continuous training for technicians and farmers about proper use of antibiotics and biosecurity, but also we work on this training with vets to improve their knowledge of antimicrobial resistance and also on the proper use of antibiotics. We work also with veterinarians so that when they meet the farmers, they can talk about antimicrobial resistance and how to prevent the prevention methods. We develop also guidance regarding the proper prescriptions by vets of antibiotics, and we promote also the good use of antibiotics toward pet owners, because they are also in the chain. The second priority is to develop alternative to antibiotics use. Alternative at first, the good practices in farming we talked about before. The second thing, we promote research on vaccination, and we promote vaccination towards farmers. Vaccination about what? About the pathogenic agents that are on the farms, and then the vets comes and make an audit and said, okay, for here it could be, you could have this pathogen, and we should vaccinate against respiratory diseases, for veal, for instance. For pork, it's more on gastroenteric disease, and so on and so on. And for instance, we have promoted the vaccination with this type of poster, which is written fed, lodged, and vaccinated for the farmers.
Let me show it to her. Get it on film, please.
So the third things, we reinforce also the regulation of commercial practices and prescribing rules. Antibiotics, on the sales on antibiotics, we cannot apply any more discounts. So if you buy 1 kilo of antibiotics and 1 ton, it's the same price. We have also decreased and some mandatory measures. We improve also the system for monitoring antibiotic use and AMR. So we monitor the sales of antibiotics in France in 1999, but because it's very important to monitor, because then you can see the efficiency of the plan. And also we promote the same approach on a European and international level. So the first is every country should have an AMR plan. The second thing is that we promote the phasing out of the antibiotic use as growth promoter. So the result, it's a success, I tell you. The objective was 25% decrease in 5 years. In 4 years, we have 20.1%, so we will achieve the goal. Now, the factors of success is very, very important. The farmers and the vet committed in the prudent use of antibiotics before 2012, since 2007. So we had the mobilization. We work as, the second thing, we work as partner. It's a partnership between public and private. We co-build, so the public authority work a lot with the farmers, with the vets, with all the private sectors. And we co-built the program with everybody. We took 2 years previous to the launch of the program to build the plan. So nobody was surprised and everybody commit and was mobilized. And the third thing, we have incentive measure, of course, but we have also a little bit of mandatory. And we need some mandatory to have a sustainable plan. So our goal is not so to finish now. We will have a second program from 2017 for 5 years, and we continue to we want to consolidate our plan. We will communicate a lot, and so the goal is to have a sustainable program. So the fight against AMR shouldn't stop tomorrow, but it should continue. And what is very important, we try also to show the farmers that it was a good investment to make all these efforts. And we got some testimony for farmers. They said, okay, perhaps we make all these efforts, but of course we use less antibiotic, we have less costs, but also we are in a better welfare, because we know that our animals are less sick, and when they are less sick, we are not so worried every morning, every night too. And so thank you very much, and I'm waiting for the question.
It's so encouraging to hear a success story on this very serious issue, I think. Excellent, excellent. And by the way, we're challenging these presenters to give us all this great information in such short time, so thank you so much. Excellent so far. Any clarification question? Remember the substantive questions again? Everything's so clear. This is wonderful. We're going to the questions now, aren't we?
Yeah, sure. Yeah.
Could we just go around and collect? If you have written down any questions, can you just hold them up now and we can have people collecting? We're going to have about a 10-minute. Meanwhile, anybody else for questions? Let's just bring them in. If we can go around and collect, we'll collect a few if you have them written down. Can't see a thing in these lights, of course. And if you can write down and collect any of them, we'll bring it. Sorry, mate. But before we go to these questions, can you all just stand up for a moment? I mean, I know it's a bit of an annoyance, but I think if we just have a little stretch, get the energy back in your limbs, little stretch, get ready for some good Q&A.